People may need urinary catheters due to urinary incontinence, urinary retention, surgery on the prostate or genitals, or other medical conditions such as multiple sclerosis, spinal cord injury, or dementia. An intermittent catheter is inserted to empty the bladder and then immediately removed. Many people have medical conditions that cause them to be unable to void. They catheterize themselves using this method 5 to 8 times a day. The risk of infection is lower than using an indwelling catheter. French catheters or straight catheters are used for this purpose. These hollow tubes are made of soft rubber or plastic. They are used to obtain a specimen or drain the bladder. An intermittent catheter does not remain in the bladder. Foley catheters have a balloon surrounding the neck. The balloon is inflated to hold the catheter in the bladder. This is known as an indwelling or retention catheter. The insertion of a catheter is a sterile procedure. Closed urinary drainage systems protect the patient from infection. The patient may complain of the feeling to urge to urinate due to the pressure of the balloon on the internal sphincter of their urethra. The pressure feels the same as the sensation of urine pressing on the sphincter. If the patient with a catheter complains of feeling the urge to void, notify the nurse. A suprapubic catheter is inserted surgically through the abdominal wall directly into the bladder. Have you ever seen the rain? A condom catheter is an external catheter used in the care of incontinent males. It is applied over the penis and attached to drainage tubing. Remove the catheter daily and wash and dry the penis well. The risk for complications is very high, and keeping the patient clean helps reduce that risk. You have definite responsibilities as a CNA when patients are using urinary drainage. Apply the principles of standard precautions. Use aseptic technique when caring for the catheter or the drainage system. Keep the urinary meatus clean. Wash the area around the meatus daily with a solution approved by your facility. Check regularly for signs of irritation or urinary discomfort and report them to the nurse. Secure the tubing so that there is no strain on the catheter or tubing. Apply a catheter strap or adhesive holder to secure the tubing. Maintain the drainage bag below the level of the bladder. Never elevate the bag, as this allows urine to flow back into the bladder. Instruct the patient to carry the bag below the level of the bladder when ambulating. Attach the drainage bag to the frame of the bed, never the side rail. Attach the closed drainage bag to the frame of the wheelchair or chair. Use care when lifting, moving, and transferring patients with catheters to avoid accidentally dislodging the catheter by pulling on the tubing. Do not open a closed system. In certain medical conditions, the physician will order an hourly output measurement. In this situation, a catheter drainage bag with a urine meter will be used. The urine drains into the small chamber. You will empty this chamber every hour and inform the nurse of the output measurement. Check the entire drainage setup each time care is given and at the beginning and end of your shift. Monitor the level of urine in the drainage bag. Most people excrete about 50 to 80 milliliters of urine each hour. If the level of urine in the bag does not change, if the catheter is leaking, if no urine is present in the bag, or if the urine has an abnormal color, odor, or appearance, inform the nurse.